Good evening, everyone. My name is Vicente and I'm here to present to you how legalizing marijuana would be a negative effect to California, not only in a social matter, but also in an economic matter. Now, the 3 points that I wanted to prove to that is how legalizing marijuana would increase government spending. It would also create a drug-driven environment, as well as increasing drug trafficking. Now, through these points, I would like to say that increasing government spending would also due to the abuse of the substance. And a report done by the Department of Transportation, which was released in December of 2009, stated that 1 in 8 nighttime weekend drivers tested positive for an illicit drug, including marijuana. So by that, I want to say that drug driving is also a harmful and unsafe manner, making us more susceptible to accidents and injuries, which would lead to an increase in cost of drug checkpoints, police patrols, and also hospital bills and so on. And also related, in addition to that, I want to say that increasing drug-related medical attention services would also be an increase in government spending. Now, data from the 2008 National Survey on Drug Use and Health, which was published in 2009, found that in 2007, more than 120,000 people showed up voluntarily to a treatment facility and reported that their substance of abuse was marijuana. And in addition to that, I want to say that in 2008, 374,000 emergencies across the country were related to use of marijuana as well. So as you can see, if it's now that marijuana is just not legally right now, if it would be legalized, it would be increasing those numbers. My second point I would like to say is that legalizing marijuana would create a drug-driven environment. Marijuana right now is, well, I could say, is used as a gateway drug. And to support that, I want to say that Kevin Civic collected information. A person who worked at the Office of National Drug Policy during the Clinton and Bush administration found that in Netherlands, where marijuana is legal right now, the lifetime of cannabis increased consistently and sharply after it was commercialized. And sadly, it was tripled. The use tripled among young adults, all this data came from the RAND Corporation, who studied in the Netherlands. Because of that, the potential for minor users will increase, as it is more available to people that are 21 and older. But since people are allowed to have, would be allowed to have their own plot to grow at home, a 5x5 plot, it'd be more common for people to sell their own drug and to anyone without a legal permit. Now, since marijuana is considered a harmless drug, many who have become accustomed to the high after several uses or constant use will search later on for a stronger substance, which again is considered as a gateway drug, which can maybe perhaps lead to cocaine or even ecstasy or any stronger drugs. And also to support that, I want to say that marijuana is a necessary option for pain relief and other medical uses. Now, there was a report done by the Drug Abuse Warning Network from 2004 to 2008, which said there was an increase in non-medical use of narcotic painkillers, an increase of 111% between those 4 years. Now today, in 2010, there could be a higher increase since, as of now, there's an obvious use that people are allowed to have prescription painkillers, and they think that's pretty bad as it is. But with the use of marijuana, it's also in addition to those narcotic illicit drugs. As of right now, marijuana is the current leader of substance dependence, more than alcohol, affecting 4.2 million out of 7 million people. Now, in relation to tobacco and alcohol are used regularly by American population, tobacco use being at 30% and alcohol at 65%. So if marijuana is more available to the public, the number would increase and relate to alcohol and tobacco, and later on be more affected to the California in general. Now, the third point that I want to say is legalizing marijuana would increase drug traffic. As the growth in current marijuana consumers will grow, there would be more search for lower tax-free marijuana, since more people would like to pay less for their little drug. Now, since drug would be offered publicly, the allowance of marijuana as a recreation drug would increase, and also the consumers of the substance. And with an added tax, like I said, there would be more of a dependence to look for a lower price, and since more people would be allowed to grow their own drug, there would be more people selling in the streets. And to support that, as of now, I want to say, by research done, marijuana is very easy to purchase in the streets as of right now. But with more people selling, it would be more obvious to sell, like more purchases. And in conclusion, I just want to say how legalizing marijuana would obviously increase government spending, create more of a drug-driven environment, and increase drug traffic overall in California, which would all in all create a negative social and economic matter here in the state. Thank you.
All right. The proposition's clearly labeled. You have a pretty good setup of what the secondary points are going to be, and you signposted them adequately as you got to those individual points. I thought on the first point you had some good background data on the potential risks, but what's missing there is an argument about how that's going to get worse with legalization. I think it's largely a presupposition on your part, and there's not really much proof on that. When you get to the second point on it being a gateway drug, the whole first section of that second argument really is the stuff that was missing on that first point, that there's going to be increased use. On the second half of the argument, suggesting that other drugs are going to be used, you have no supporting evidence on that point. So I get rid of the gateway statement, talk about how legalization is going to increase access and as a consequence increase use, and then show us how those problems that result with use of marijuana currently will as a consequence increase substantially. On your third point, you've got an interesting theory there, but I didn't really hear much evidence that supported any of those points. It seemed to be a lot of theory and conclusionary statements. You're rushing a bit on the presentation. You can pace yourself a little bit more effectively.